Okay, today we're just going to run through 4 exercises to help release tension in the pelvic area. We're going to combine some breathing and then stretching through the muscles that attach into the pelvis and often fire up the pelvic floor as well. So we're going to start with breathing. So Joe is going to take a big breath in and let his tummy rise and form. Close your eyes. So just trying to get the patient to focus on a nice long in-breath and a long out-breath. You're just trying to slow that breath down, deepen it, lengthen it, and out. And what we're looking for here really is for the diaphragm to move. We want that diaphragm to descend and then as a result the pelvic floor to release. So I often say to the patients before they start their stretches to do 8 to 12 release breaths through the tummy and pelvic area. And then once they're in their stretch position, to add the breath. Good. One more for me. Take a breath in. Good. And breathe out. Well done. Okay, we're going to add our first stretch, which is just bringing the knee to the chest. Hold on to that with one hand, okay, and then keep the other hand on your tummy. So the other leg is out nice and straight, released, rolled out to the side if you can, and then breathe into the tummy and out. And again. Again, depending on the patient, where they have their area of tension in the pelvic area, you can guide the knee into a bit more external or internal rotation. So again, breathing and stretching. So here we're getting a nice stretch down through and into the pelvic area. Good, change sides. So I would do, again, 8 to 12 breaths each side. Ideally, again, you want the patients to do 10 minutes of stretching morning and evening. Asking them sometimes to do 30 minutes, 45 minutes isn't very practical, but just getting them into that habit and discipline of doing a little bit every morning before they start the day and at the end of the day. Good. Okay, once you've done both sides, then bring the 2 knees into the chest, go into happy baby pose. Again, bring those knees out underneath the shoulders. Again, in a nice relaxed way, not causing any tension, but just really releasing, relaxing through, Joe's a bit tighter on the left, through the pelvic area. And starting to work into our adductors a little bit, which really can get very tight with men and women with pelvic pain. And then that feeds into the second deep layer of the pelvic floor. So in a nice, a lot of the patients really like this stretch. So getting Joe to just do 2 more breaths, breathing in, sending the breath down to the pelvic area so we get a nice release through and a bit more blood flow through the fascia there. Good. And rest. Then you've started to lengthen out the adductors here a little bit, so let's just go down into, you can do your adductor stretch with the feet on the floor and getting the patient to then give a little bit of an extra stretch, not causing any pain or anything, but just an extra stretch through the adductors. Obviously, you could also do all your manual therapy to release through the tight muscles beforehand, then it's easier for Joe to get a stretch. So in that position then, relax the shoulders, roll the head side to side, just release off, and then get them again. Breathe into the tummy, and out. And again, breathe in and out. As they progress, you can bring these feet, let's bring the feet up to 90 so we could get Joe. Good, well done. And there again, keeping an eye always on the alignment through the head and shoulders. There's no point in them stretching out and lengthening through the abdominal and pelvic areas, and they shorten neurally through the neck and shoulders. Good. Good, and again here, encouraging the patient just to give a little bit of extra stretch, lengthening through those adductors so they're relaxing through the pelvic area. And the breath, breathe in, tummy rises, good, and out. After that, then Joe could go straight into his Piriformis Stretch. So put that left one over. And relaxing the shoulders. And again, just getting comfortable in the position. And then as the muscles in the external hip rotators and piriformis relaxes a bit more, you can draw it in a little bit deeper towards the chest. This is good to do as well against the wall. You can put the foot against the wall, because often patients, trying to draw their knee in, they create lots of tension in their neck and shoulders. So again, with this foot up against the wall, then they can focus a little bit more and monitor their breath. 2 more breaths. Big breath in and out. And then rest through to the other side just to keep you balanced. Good. And again, when they're in this position of stretch, I really want the patient to kind of use that breath to get the pelvic floor released. So I say, as you're taking a deep breath in, make sure you feel that it gets down to the pelvic area and you feel a little bit of a release through the area and through the pelvic floor. And rest. So they're the exercises that I would get Joe to do before he starts the day. And they're all just static stretches for the moment. Then there's other stretches which involve a bit more functional movement and also at the end of the day a bit of drainage. So legs up against the wall to stretch out your hamstrings, your adductors and your piriformis at the end of the day. Thank you.